My great pleasure to introduce our next speaker, Dana Weston. She is the president and CEO of UNC Rockingham Healthcare in Eden, North Carolina. She has an impressive track record not only in the health industry but also in working in our local community, and you can read about that on the website. I just want to point out that last year she was named the Young Healthcare Executive of the Year by the National Association of Health Service Executives and was honored as one of Emory University's 40 under 40. So I'll never receive that, but I'm pleased that she would too. So thank you. Good to see you.
Good morning, or afternoon now. It's an honor to be here as part of the ReCONNECT North Carolina series, and thank you to NC State and IEI for your work here. I can tell you that I will be brief because I too am hungry. I too, ladies, waited in the impossible line at the bathrooms, and they called us back before I got there. And I decided to choose style over comfort when it came to my shoes today. So I have done a number of conferences, commencements, programs, etc., and what I am about to do here has actually never happened before. I threw my presentation away. You might want to hold that till the end, decide if you like it or not. So I have no slides, I have limited notes, I simply changed my mind about what I was going to talk about today. So somewhere in this room, Sarah Langer Hall is so nervous that her twin is probably feeling it wherever he or she is right now. I promise it's going to be okay, Sarah, and all this stress isn't good for the baby. So let me start off by telling you all my story. I grew up on the north side of St. Louis, Missouri, urban area next to the railroad tracks. And for any of you all that have spent time in a Midwestern city, I can tell you, and you all know, they don't put the railroad tracks through the nice areas of town. I had asthma, my sister had kidney disease, my mom is diabetic, my dad has had 2 triple bypass surgeries. So when you do click on that bio to read, that's not going to be in there, but trust me that I am familiar with healthcare in urban areas also. I went to college at Emory in Atlanta, and from there I went to graduate school at UNC Chapel Hill, did my fellowship at Duke in Durham, and I did Six Sigma Black Belt training at NC State. I say that so that I can be accepted across the ACC fans in this room. Durham felt small to me, so I moved to Charlotte. If you would have ever told this city girl that she would be living in a small town, I would have laughed, one of those good, hearty belly laughs. But in 2015, at the age of 33, I applied to be the CEO of Moorhead Memorial Hospital in Eden, North Carolina, in Rockingham County. So let me tell you a really quick story about my life in a small town. My parents came to Eden to visit when I had first moved there. And the day before their return flight, my mom, in classic mom fashion, decided that she needed to shop at a local store before their return flight home. I was new to town, and the only boutique that I knew, which is called The Front Porch, is not open on Mondays. So I texted the owner, Mel Hall. I explained the situation, and I asked her what time they were opening up the following day in hopes that we could probably swing by there before going to the airport. And the text response that I got from Mel was her home address and a note telling me to come by and get the keys to the store. I stared at my phone in disbelief, but we got in the car, we went to Mel and Neville's home, we got the store keys, and we drove to the store where I let my mom and I in. I will say that my dad stayed in the car because he was convinced that it was some sort of setup. So my mom and I shopped. She then put her entire haul on the counter, and I simply took a picture of it. Then we bagged it up, and we left. I texted it to Mel, the picture, after returning her keys, and she said, "Hey girl, glad you found some good stuff." There was no mention of price, She did not ask me to come pay her because it's Eden, and she knew that I was good for it. That's how Eden and how many rural communities are. And if you have never lived in one, you are truly missing out. In addition, because there are no secrets in Eden, I also happen to know that Mel's sister, Lisa Turlington, is here somewhere, and I promised that I would say hi. Hey, Lisa. It's a pleasure to meet you. All right. Back to Moorhead. So I knew the hospital was challenged, but I didn't really know exactly how bad it was. And it quickly became clear that it was not going to survive without a larger partner. The hospital was in real danger of closing. And let me tell you what happens when a hospital closes. There is an impact on healthcare. So UNC Rockingham is the only hospital that does labor and delivery in Rockingham County. The difference between a 5-minute drive and a 60-minute drive for a woman with fetal distress is absolutely the difference between life and death. In addition, in North Carolina, over the last 5 to 6 years, there have been as many hospital closures in our state, almost all in rural areas. And when these hospitals close, the population is funneled into urban areas for care in a way that challenges the system for us all. They arrive sicker. It means their costs are higher for all of us. They or their family members have lost wages as they travel for care. And loss of employment in rural areas will strain the tax burden in urban areas. Students in rural or urban areas who are unable to get the education they deserve because of poor health or because of their parents' poor health, we all pay the price for that injustice. But it's also bigger than just healthcare. See, the impact on the economy is huge. In Eden and in most rural communities, the hospital is the largest employer. We pay higher wages, which means taxable income and discretionary spending. It's the little things. Think about how much water a hospital uses. When the hospital closes, the water bill goes up for all of the other residents. And that may seem small to many of us in this room, but in a distressed community, that impact will be felt. If our hospital closed, there was going to be a significant impact to the viability of Rockingham County as a whole. And when rural economies struggle, there is an impact on urban areas. But most importantly, when I went there, I learned that not only did the hospital need help, but the community needed hope. And so I decided that closure was not an option. And in July 2017, I did the scariest thing I've ever done, and we filed for Chapter 11 bankruptcy protection under the U.S. Bankruptcy Code. The next 6 months I cannot tell you about because they are a lifetime documentary waiting to happen, and I want it to be a surprise when you all watch it. But ultimately, we emerged as UNC Rockingham Healthcare, part of the UNC healthcare system. Thank you. So this section is titled, "We're More Connected Than You Think." And I'm supposed to talk to you now about how rural and urban communities are connected in the nonprofit sector, specifically from my experience in healthcare. I titled my presentation, "It Takes Two," after the hip-hop classic by Rob Bass and DJ Easy Rock. It takes two to make a thing go right. I'm the only one that's fine. I'm the only one that knows it. So, since that's what I said I would say, and since I'm a woman of my word, here you go. They are connected, and it takes two. When the farmer in Rockingham County gets sick and cannot produce crops, urban prices go up, which works against the work being done in urban communities to remove food deserts and create access to fresh produce across the urban landscape. So it takes two. I'm also supposed to talk to you about determinants of health and population health. As a kid who grew up in an urban area, I can tell you that the biggest improvements in my family's health would not have come from any hospital or health system in our area. It would have been fixing our sidewalks so we could play outside. It would have been the city replacing the broken street lights so that we had a safe neighborhood to live in. It would have been someone thinking to replace the carpets in the homes in the areas where I lived in so that no child would die from a simple asthma attack. And while we were blessed to have insurance, I saw my friends with Medicaid unable to get timely appointments. I moved to a rural community, and the same issues of safe neighborhoods, appropriate housing, and access to care exist. So why are urban and rural communities working on solutions to this, like telemedicine or housing improvement initiatives, separately? Why have we duplicated resources across the state to solve problems that so many have already solved? Apparently, UPS has solved them all. We are connected, and it takes two. I was also supposed to mention why UNC purchased our hospital. And what I can tell you is it was not because we were going to add to the financial resources of that healthcare system. It was because their mission is to improve the health and well-being of North Carolinians, with no caveat about where in the state those people live. It's because the academic and research focus drives them to search for solutions to the challenges of rural healthcare across our state. It's possible that it's also because that small hospital in Eden has a really annoyingly persistent CEO who absolutely refused to look in the face of her staff and her community and tell them there was no future. Whatever the reason, UNC Healthcare bought into the philosophy that we are connected and that it takes two. So that's the summary about what my slides were about, and I threw them away because it doesn't matter. You will hear plenty of speakers today tell you about why we should bridge the gap between rural and urban. You will hear data about what connects us. You will hear possible solutions to our challenges with connecting. You will hear the why and the how around housing, behavioral health and substance abuse, recreation and open space, transportation, workforce and economic development, and the work that all of these great minds have done won't matter unless everyone in this room has decided that you care. And I don't mean that you care when you have the funding, or when you're not up for re-election, or when you have time. See, I love what I do. I really do. And while healthcare is my passion, my purpose has always been to do what I can to create a world that is good. And that was starting with creating a United States that is good. And what better place to start than creating a North Carolina that is good? A North Carolina where the goodness in your life is not tied to the zip code where you live. And believing in this goodness means caring about rural when you live in an urban area and caring about urban areas when you live in a rural community. It means caring about solutions that are not immediately revenue generating. It's about caring across party lines, caring for those outside of your voter base, even when it's campaign season. It's about caring about creating a world that is good. That is the only way the maps, the graphs, the studies, and the knowledge that is shared today moves us to action for the last, the lost, and the least across all areas of North Carolina. So I want to thank you for being here today, for taking copious notes on the data, for talking with absolute strangers at your table about your experiences and learning from theirs. And I'm actually okay if you don't remember anything about population health, determinants of health, or the challenges of healthcare delivery, because honestly, you can Google all of that. And if you don't know how, there's a lot of millennials in the room. I am only asking you to do more than just connect today. I am asking you to care. And my original presentation was titled, It Takes Two, but when it comes to caring, to trying to create a North Carolina that is good, it starts with one. You. So in closing, I am going to ask you to do something. And I apologize if it feels elementary, but there is a power in speaking something out loud. Your brain actually processes it and remembers it in a different way. So I'm going to ask you 2 questions. But to make this pop quiz easy, I'm actually going to give you the answers in advance. So the answer to the first question is, if not me, who? You all try it out.
If not me, who?
Perfect. Gosh, a smart room. The answer to the second question is, if not now, when? Try it.
If not now, when?
Okay. If not me, who? If not now, when? First question. Are you willing to create a North Carolina where the goodness of your life is not tied to the zip code where you live? Is it a good time to prioritize this work? One more time, because I really didn't hear some folks. Are you individually willing to create a North Carolina where the goodness of your life is not tied to the zip code where you live?
If not me, who?
And is now a good time to prioritize this work?
If not now, when?
That's all I got. Thank you very much. I think we're trying to catch up on some time, and so we're not going to take questions, but there is a gentleman somewhere in this area who asked me a Medicaid expansion question earlier. I just wasn't up here. There you go. So I do want to say this quickly, and I did tell Sarah that I was going to answer this question even though I wasn't actually asked it. So Medicaid expansion has become two words that are so politically charged. So I am going to ask us all to delete it from our memory banks. And instead, we're going to talk about increased access to health insurance, right? Because that's really what we're talking about, is increased access to health insurance. Why does that matter? There are about 18,000 veterans in North Carolina that are unemployed. Contrary to popular belief that these are lazy people without insurance, about 60% of the folks in our state that fall in the coverage gap are hardworking people. They are small business owners, they are first responders, they are clergy, they are farmers, and they simply cannot afford health care. About 21% of those in the coverage gap in North Carolina are parents with children, and we know for a fact that parents without insurance coverage have children whose health is not the same as their peers whose parents have insurance coverage. So it's important for our state to expand access to health care insurance. When we do that, we will see an improved workforce. We will have better impact on the opioid battles that we are facing today. There are a number of reasons why improving access to health care insurance matters. But I do want to say this, and in the short session, there are some legislation that got bipartisan support, and I hope to see that continue. However, for Moorhead Memorial Hospital, increasing access to health care insurance would have extended our runway. It would not have prevented closure. And the partisan stances on this issue and the way media has then sensationalized it has been a disservice to all hospital and healthcare systems because it's not the sole issue that we struggle with. So do I believe, along with most healthcare administrators, that increased access to insurance matters? Yes. But I think we also have to talk about parity and reimbursement so that we get paid for things like telemedicine, which can really help those of us in rural areas. We also have to talk about the increasing regulatory burdens that hospitals are sinking underneath. We have to talk about aging facilities, increased needs of technology. There is not one silver bullet. So I encourage all of you to continue to help our state work towards solutions for increased access to health care insurance. I ask that you forget the words Medicaid expansion ever existed, and I ask that you will help us find solutions for all the challenges that rural hospitals face and not just that one. Thank you.